across the system. Many of them, many people on this call here, but this newsletter, the newsletter and recordings go out to a really wide range of frontline practitioners, from volunteers in food banks all the way to specialist services in the NHS. So we do have a really fantastic resource in here today, and I'd really encourage you to utilise the opportunity in this space, and when we do come to the open forum discussion, to ask any questions about services that you be interested in for the residents that you're working with to support, or anything that you want to promote or let us know about. I know that Joanne's got something really exciting going on at Queertopia. I'll be inviting Joanne to tell us about the family picnic, and anything else, and anything that's shared in the session today, we do try to also include in the newsletter. So if you did want to include a flyer or something on anything you've shared, you can send that to John after the meeting, and we can then share that with everyone who's not here today. So without further ado, I will pass over to Fiona from MRS. Take it away, Fiona.
Right, yeah. Hi everyone. Thanks again for sharing stuff and moving things around. For those of you who don't know us, because I have done a talk before, but this is about something specific in relation to Hoarding Awareness Week. I work for an organisation called MRS Independent Living. Sorry, it's been a long day. We work principally in Hackney, but across North East London, providing an eclectic range of services targeted at older people, people with disabilities, to try to ensure they are safe and independent in their own home for as long as possible. That's the kind of strapline for what we do. I manage I think it's a really good service, because I don't deliver it, I only manage it. A service that works with individuals with hoarding disorder and concerns around clutter, called Making Room, which I have talked to this, well, probably not all of you before, but talked to in this venue before. But I'm talking to you now because 12th to the 16th of May is Hoarding Awareness Week. And to help raise awareness for this, Making Room, well, MRS are doing two things. We're going to be present, thanks to Tim Jones at the Hackney Service Centre, in the foyer at the Service Centre on the 13th and the 14th, to talk to people, to chat about what we do and about what support is available for hoarders and those kinds of things. And not the real reason, but the principal reason about talking to you today is we are offering 2 free virtual, have to get that in the right way around, taster sessions around the training that we offer, but also about, again, raising awareness about hoarding. So I'm going to try and share this with you, because I hope I've done this properly. So we have I don't know where we go. Hoarding Awareness Week. Hope this is the flyer. Yes. Some of you may be guessing, as it comes through, some of you may be guessing this flyer simply because I've the database of every single person that we've had referrals from in a professional capacity, and sent it out and said, and it kind of says what it does on the tin. It's a pre-session, 15th of May, online. These are the things that we're doing. Thinking about hoarding, existing responses or lack of them, shall we say, possibly. Some case studies that may provide useful learning for Making Room, and how to get support or refer to us. I'm going to put in the chat, I hope I can do this, the link to, hopefully has that gone through? Come on.
Yeah, we got it.
Yeah, sorry, it might have gone through twice. That's the link to the Eventbrite if you want to. I think we've got, in my dreams, that would be a bit too many in there. There are up to 300 can sign on, which I don't think we're going to get anywhere near. But if you or anybody else you know might be interested, please forward the link, ask them to sign up. Please, you can get in contact with me, but it's easiest to sign up on the link, and we would be really great to see you. I think it'll be quite a good, it's not going to be able to be as interactive as we would like it to be, for obvious reasons, if we have 300 people, but we will do our level best to kind of make it interesting, make it more interactive, and to answer people's questions as and when they come up. We're also, just as a kind of FYI, and if you do know anybody, doing a session the same day, so still virtual, 2:30 till 4, for individuals who've got concerns about their relatives or friends hoarding, and anybody else who, without in an observationary way who are non-professionals, not judgmentally. So if you know of anybody else who might be interested, God, don't have the link for it because it's not gone live yet. My email is in John's email somewhere. Just email me and I can send the flyer out for them as well. So that's probably all I want to say. Happy to take questions, but essentially that's it. Hoarding Awareness Week. We're trying to raise awareness by doing some stuff in our own small way. Over to you.
Brilliant. Thanks, Fiona. Short and sharp and to the point. It's great.
If you really want me to go blah 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 for the next 5 minutes, I'm really happy to do it. But you know, a bit boring, really.
Yeah. Well, no, I mean, I think people will have lots of questions. Does anyone have any questions for Fiona about the work or about, I guess, issues of hoarding in general in Hackney, or anyone that you might be working with, you might be worried about, or obviously not specifics in terms of individuals, but the sorts of issues that you might be coming across, or the sorts of, anything that anyone wants to share?
I mean, Jenny, what I should say, if people want me to talk very briefly through the process, I'm really happy to do it. But this was specifically about Hoarding Awareness Week. So
let's see what people want to hear about. And then Tobias, do you want to?
Yes, I want to say that I know nothing whatsoever about hoarding, and I'm really intrigued that I know people who hoard, but I'm really intrigued that why is it such a big issue, and why is it something we need to address?
Right, why is it such a big issue? Because it's estimated between 3 and 5% of the UK population have significant issues. Well, right, let's put it, whose hoarding impacts severely on their life, shall we say. Now, that could be simply because the hoarding is waist level or above and there's a huge fire risk, or it could be they feel, lots and lots of individuals who hoard report feelings of shame, etc., and they can become, and many do become, very socially isolated, and a reduction in their lives. So it's a risk to them and their neighbours if it's a fire risk. It's not great for their lives, and we're about trying to help people, rebuild social relationships, become more involved in the community, and to keep them as happy and healthy as they can be for however long. So lots of people have it, huge impact. And if you want the brutal stuff, significant costs to services. Birmingham, one of the boroughs around Birmingham recently did a kind of long line financial assessment about what hoarding costs. And the lifetime of a hoarder, in the sense of the lifetime from when they come to statutory services attention to when the issue is completely resolved. And with a number of them, it was up to about 200k overall costs. Now, in these extremely cash-strapped times, anything, and I'm not just talking about making room, but anything that can be done to help reduce those costs frees up money either to work with more individuals or hold, or for other things. So there's a financial cost and there's a huge social cost as well.
Thanks, Fiona. Joanne.
Hi, Fiona. I was just curious to know, how do we support our service users or beneficiaries to access your service? Considering all the shame and things like that, what would be the best approach to actually speak to them and encourage them to, access your organisation?
There's not an easy answer to that. And can I say, I'm not the kind of professional, but I'm manager, so I don't have all of the answers. And our senior practitioners we run a social group, so can't be here. How would be I think there's a number of answers. One, if the individual knows it's impacting on their life in some way, in the broadest sense. So it could be around, there are issues with housing, and the housing, if it's housing provider and their housing provider wants to get in to do the checks, and they are making threatening noises, or they are making threatening noises because the impact of the hoarding, for example, infestations, is impacting on other people around where they live, those kinds of things. So if you're going in the context of the individual is aware there are issues, and actually those issues relate to the hoarding, being able to say, we know sort of like something needs to be done because of these reasons. Would you consider having us making referral? Sorry, we'll talk through making referral to Making Room, who could support you to do this. But it's starting the conversation. I mean, I think John will probably say that virtually everybody knows that it's an issue. They might not want to address it because of the shame, or they might think, yeah, it's okay to live like this, even though they think deep down that it's not. But if it's not because they're being a danger either to themselves or to other people, or things can't happen because, for example, people won't get into property to do various checks, then it is impacting on others. So it's kind of seizing the moment. It's about having the conversation generally and seizing the moment and thinking, okay, is that, I mean, I appreciate it requires some skills on the whoever's doing its part, but there isn't an easy way unless somebody actually says, I want to do something about it. It's about being gentle, non-judgmental, not looking at, oh my God, as we've had somebody say, oh, I've just stepped on something disgusting. This was a social worker, which is like the most, it might have been disgusting, but the most inappropriate thing to say. So it's about taking that non-judgmental approach. We're here. We do need to do something. What can we do? Would you like some support?
Sounds very much like a trauma-informed approach.
Well, yes, I just...
You would really, yeah, that you're describing, that I guess so many of our practitioners on this call talk about, even, you know, I mean, we talk a lot about the words, don't we, a trauma-informed approach, but I think there's no greater skill than those on the ground doing the work. And I guess we've got 30 people on this call, some of whom have vast experience in having those really difficult conversations, whether it's about hoarding or anything else. So I think it's really helpful to hear that from you, Fiona.
Yeah, I mean, I'm not going to tell you exactly how to do it, but it is just about having conversations, but the gentle conversations.
Yeah, and building that relationship.
Yeah.
Is that all right, Joanne? Did you want to come in on anything in relation to that?
No, I just really appreciate that, because, you know, with like some of the beneficiaries that I've worked with historically, they might know that it's a problem. However, convincing them to have a service to come into their homes, it's you know, it can be very challenging and upsetting for the individual as well. So I was just curious to know, like, you know, is there certain, I don't know, sort of key things to kind of focus on to support them to make those types of decisions, you know, that's going to help them in their lives?
I think it is about being gentle and taking it slowly. I mean, we actually we've been working with one individual for over a year now, who our practitioner has never actually been inside their home. She brings the stuff out into the garden and they sort through it in the garden. For example, we do an assessment. I mean, I'm talking for the process, but we will do an assessment where we talk with the individual about whether, this is shorthand, obviously, whether somebody, are they in the right place to want to do something about this? If they're not, the way that we work won't work, because if people don't want to, or they're still resistant or won't acknowledge, there's no point. It's about working with somebody who thinks, yes, I do want to make these changes, and supporting them to make the changes in the way that they want. So again, we go along and do an assessment, but sometimes we might have a cup of coffee or meet in the park with this individual 2 or 3 times before they are comfortable enough to either even acknowledge that, oh yes, maybe we should talk about the hoarding, or to say, okay, maybe you should come and have a look now. So it's taking it as slowly as we can, because we are a spot purchase service. We're not grant funded, which is always the issue, obviously. So taking it as slowly as we can, but allowing people to come to their own conclusions about whether they want to work with us or not. And if they don't want to work with us, whatever the referrer might want to happen or might feel have happened, there is nothing we can do, because if they don't want to work with us, then we can't. The way in which we work isn't going to be very effective, because it's about working with and helping people, as I say, rather than doing kind of the blitzkrieg, blitzclean approach. It's not easy, and I can say this again, it's very skilled work, because it's not me that's doing it, but it does. We reckon about 75% of the people we work with and who finish the number of sessions that we think they need, the place remains at the stage that it was when we left. But I should be really clear again, this is about for those of you who are aware of this, there's a clutter rating scale that goes from 1 to 9. 7 to 9 is the highest. Somebody who's clutter rating 8 might only go down to level 4, but which people might think, oh, that's not good enough. But actually, if we've reduced the risk and the risk is significantly less, the same thing, sorry, then 4's fine if it stays the same. So it's not about going from an 8 or a 7 down to perfectly immaculate, everything in its place. It's about reducing the risk. It's not about imposing our views about what a nice, in inverted commas, home should look like. I realise I'm getting really ranty. Sorry, guys.
No, no, I appreciate that. And I agree with what Jenny said. You know, it sounds like great examples of trauma-informed care approaches that's used by your practitioners to engage people into the process. So, yeah, thank you.
You're welcome. And thank you.
Yeah, thanks for the question. Is there anyone else who had anything they wanted to share in relation to Fiona's presentation or what's been discussed, or should we move on to the next presentation? I think we have Graham next up. No more questions? Okay, over to you.
Thanks for your time.
Oh, okay, thanks so much, Fiona. Thanks.
Hi, Jenny. Hi, everyone. Thanks for having me. Hope you can hear me all right, but let me know if not. So I'm Graham from Resolve Poverty. We're an organisation that works locally to end poverty nationally. And I've just got John invited me to come and speak to you primarily around the sort of training offer that we've got, but also just more generally about the work that we do. So I'm just going to try and share some slides. Okay.
You're right there, Graham, or do you need?
Yeah.
Yeah, you got it.
I've got them now, yeah. I'm not used to using...
No, it's hard when you have to switch platforms, isn't it? You get really used to Teams or Meets or Zoom, don't you? And then it's hard to...
in a minute. So...
Yeah, is there a way of showing it bigger?
Sure.
I think there is also, for those who need it zoomed in further, there is also a zoom button toward the bottom on Google Meets if you don't know about it. So once, for slides that you might need to see for those who
Okay, right. Let's try and see how we get on with this. Yes, I'm not used to using Google Meet. So yeah. Anyway, so about Resolve Poverty. So we work locally to end poverty nationally, and we support organisations across sectors to think about sort of strategic and policy responses to poverty, but also practical ways to respond to poverty as well. So kind of our sort of messages, we know that the main levers to tackle poverty sit with central government. You know, we know there's big things that we want central government to do to address poverty in our communities, but we also know that there's lots of things we can do locally as local public, VCSE sector and private sector stakeholders. Core to kind of our focus on poverty is a focus on maximising the financial resources available to households, and it's kind of that's really important to us. We know that poverty is a complex issue. It's often a contentious issue as well. Poverty often gets conflated with other kind of social issues that we might want to address. We know there's a strong correlation between poverty and low income and a range of kind of poor outcomes and experiences for people. So one of the things we're really keen to do is support stakeholders to really focus on that kind of maximising the financial resources available to households aspect of any anti-poverty work that they're doing as an organisation. We work with a network of over 4,000 professionals and volunteers who are actively engaged in local and regional responses to poverty. So those individuals and volunteers receive our newsletter, get invited to our events, engage in our policy work. In terms of our training offer, So we've got a number of different training courses that we offer to organisations on a kind of paid for basis. These are provided as like open training courses. So we have dates throughout the year that anyone can book onto, but also offered as bespoke courses as well to individual organisations where that kind of beneficial to the organisation, and where we're speaking to multiple members of staff would deliver a benefit and enhance kind of the training offer. So our expertise includes work around maximising household incomes, utilising poverty data, ethical and effective lived experience engagement, and then designing policy and strategic responses to poverty. And I will say a little bit more about each of those areas in a moment. Just to say, as we're going through as well, you'll see on this slide and the next slide, you'll see the contact details of my colleague Tom. So, you know, obviously people can reach out to me after today's meeting, that's absolutely fine. But also do make a note of Tom's email. So thomas@resolvepoverty.org, he's our head of development and can signpost you to the right person to speak to if you are interested in engaging in any of our work. So just to start with our anti-poverty strategies work. So we've worked with several councils on the development of new anti-poverty strategies. People might be aware that the government is due to publish a national child poverty strategy in the summertime. They say spring, but really they mean summer. And that'll be the first time we've had a meaningful anti-poverty strategy at a Westminster government level in well over a decade. What's kind of happened at a local level is some local authorities working closely with partners have had local anti-poverty strategies anyway, and usually that's driven by a desire to kind of coordinate local anti-poverty work, and also to create a space for, because what we've seen, another thing we've seen over the last 10 years is local authorities and partners, particularly voluntary community sector partners, have got sucked into kind of crisis responses to poverty, largely a result of kind of failings with the national benefit system and because of the prevalence of low pay and insecure work. And local anti-poverty strategies are often a good way of creating a space for local partners to think about how they can also reduce and prevent poverty in their area and what options are kind of open to them there. So kind of really important. So some local authorities working with partners have got local anti-poverty strategies in spite of there being sort of no kind of national anti-poverty strategy or requirement on local authorities in England to have a poverty strategy in place. What we are seeing with the announcement that government will have a child poverty strategy by the summertime is that more localities are interested in this agenda and thinking about what does that mean for them. So really kind of interested in, you know, it's acting as a catalyst for more local authorities with partners to think about their role in tackling poverty, but also actually other parts of the public sector, increasingly health, thinking about kind of what role they can play. So we supported some councils with the development of new anti-poverty strategies. Sunderland is a council that we're supporting with that at the moment. Bolton's a council we recently supported with that. But we also provide kind of ongoing strategic oversight and evaluation and review and updating of existing strategies to councils that have already got an anti-poverty strategy or local poverty plan in place. So that's kind of our anti-poverty strategies work. Then just in terms of some of the training courses that we offer, so the first one, which we've actually been delivering to people today, and we had a really good mix of attendees from across the country on today's course, is our maximising household income training. So this looks at kind of a deep kind of understanding of the social security system and the financial support available to help people maximise their household income. And we really work hard on that course to kind of go past just the kind of benefits that are available to people, but into kind of other areas of financial support that exist, whether that's social tariffs, whether that's support from utility providers. But also we spend quite a lot of time on that course thinking about what are the innovative ways in which we can work collectively as local partners to maximise household incomes, what are the campaigns we can run, what are the interventions that we can put in place. So we have, like I say, delivered that course today and had a really good mix of attendees from across localities and across sectors. Second course that we deliver is our valuing lived experience training, and there's quite a lot of interest in, you know, how to do this well, particularly in the field of kind of anti-poverty work, whether that's about kind of how services are designed or whether it's about policy design and policy implementation. But, you know, how do you engage with people on low incomes in a meaningful way? We know that kind of some of the traditional ways in which we might engage with residents at a local level don't necessarily reach marginalised groups, including people experiencing socioeconomic disadvantage. So that course is about how we can engage people with lived experience of poverty in a meaningful, deep way, and a way that's ethical and fair. And also we kind of touch on in that course kind of how to do that in a sustainable way, because again, you know, if you're going to do this lived experience engagement work well, you need to resource it. So you can consider some of the options and models that exist in respect of that. Third course that we deliver, and this is also available as a kind of open course, and I think we've got a date for this coming up next week actually, is tackling poverty with data training. So this is all about looking at kind of what does data tell us about poverty in the UK, so quantitative data primarily, and how can we use that to help design and target services and anti-poverty interventions. So really valuable course. We've had a lot of really good feedback from people who've attended this course, and it's really trying to take some of that kind of plethora of kind of quantitative data that we've got, like about poverty or things that relate to poverty at both a national level and local level, and turn them into something meaningful for attendee services and the work that they're doing in their communities. So kind of really important to think about how can we make that quantitative data our friend and our ally when we're designing responses to poverty in our communities. And then the last one just to talk to you about is our poverty awareness training. This is just delivered as a bespoke course to individual organisations. It is available as an e-learning package as well. So we've delivered this to councils as an e-learning package, which has meant they've been able to open it up to all staff and voluntary community sector partners, which has been really powerful and impactful. Most recently, we've been delivering this training to a regional ICB. So delivering it to health professionals in that area, and reached over 1,400 professionals through delivery of a bespoke poverty awareness training course to them. And that's been great because it's meant we've reached people working in any kind of health role that you can imagine, and being able to have conversations with them about how they think about poverty in respect of their role. You know, we've had chemists on that course, we've had GPs on that course, we've had people working in policy and strategy roles in that course, and it's allowed them to really think actively about, okay, we know that poverty underpins so many of the challenges that we face in our society. How do we incorporate that into the way we deliver the services that we deliver? So in that course, you'll understand about how poverty affects peoples and communities you work with, best practice for supporting people in poverty effectively, safely and respectfully. And that includes very practical kind of hands-on support about, you know, how you have conversations with people about money in a confident and comfortable way. How might you, as an agency that, you know, isn't an advice agency, isn't kind of an organisation with trained benefits advisors, how do you refer and signpost people into support that's best meets their needs? And we also look at strategic and policy responses to poverty in that course as well. So all of those courses and information and detail can be found on the Resolve Poverty website, so resolvepoverty.org. We've got a dedicated training space on the website, but also you can go to our website and find out more about what we do. I think what we're really keen to kind of do as an organisation is think about how the training links into our wider work. You know, we're quite well plugged in now to kind of some of the national policy conversations that are happening around the benefit system and the new child poverty strategy. And I'm really keen to think about, well, what does that mean for localities? How can we do more at a local and regional level to tackle poverty in that context?
Great, thanks, Graham. Lots there. I'm sure there's going to be lots of questions in the space. It's yeah, it's a lot to take in. Does anyone have any questions for Graham, or any reflections or anything that you want to sort of draw out from that? I'm burning with questions, but you know, I want to wait for others. Is there anyone? I mean, is this something that people think that they might find useful in their services, whether you're a council, you know, whether you're coming here from a council service or a voluntary sector organisation? Does this feel like a useful training offer that services might find helpful, or any thoughts? I guess I was interested, Graham, I guess thinking about this space and thinking about particularly the Hackney context, that around your experience, I suppose, with all the different pieces of work that you've been you're aware of around poverty in the UK, you know, since the pandemic and cost of living crisis, around the collaborative and relational ways of working, and the kind of importance of that whole system response to poverty. I mean, this session was set up, we set this session up now 3 years ago as a sort of response to struggling to get all the information out there about what support was available to residents around the cost of living crisis. So we'd been doing lots of more relational work through the pandemic, and we'd recognise how helpful it is to bring sector partners together, voluntary sector health, all the frontline services that are working with the most vulnerable. And so having this meeting initially was about getting that information out, and over time has really become a really valuable space for enabling collaboration that then can lead to sort of co-location of services and sort of direct impacts for residents. And I know Neil's going to talk to us about some of the things that we've evolved from this kind of collaborative space. But I just wondered if you had any reflections around the sort of importance of that collaborative whole system approach to working on poverty, if we are to have that sort of long-term sustainable approach.
Yeah, no, absolutely, Jenny. Yeah, I mean, that collaboration is really kind of important for the reasons you've alluded to. I mean, and what we do see in some areas, you know, is a lot of anti-poverty work is sort of reactive and kind of initiative-led, and, you know, there's a risk that comes with that in terms of duplication, but also kind of often a lack of awareness of the support and services that might be available in an area. You know, one of the things that sort of food banks will often sort of say to us is, you know, they might have a local public sector agency that's referring or signposting people to them regularly and bypassing perhaps the council's own, you know, council tax support scheme or local welfare assistance scheme. So it's really about that collaboration. Part of that collaboration, part of the value, is about equipping all stakeholders with the knowledge about what is available in an area, and then maximising residents' opportunities to access those services in a timely and appropriate kind of manner. So that's really important. The other thing, more from the kind of strategic kind of collaboration point of view, is sort of the recognition that no one organisation in a locality is going to be able to tackle poverty on its own, given that, you know, the depth of the issue in most of our localities, communities across the country. And given, you know, the paucity of resources available to individual organisations, including local authorities, who've obviously experienced, you know, really significant budget cuts over a number of years. So that kind of strategic approach and collaboration and bringing partners together is a way of kind of maximising resources, avoiding duplication, and also making sure that all partners take responsibility for the issue. So usually, like, we talk to a locality about having an anti-poverty strategy, it's usually led by the local authority, but developed and then delivered in partnership with other parts of the public sector, but also voluntary community sector organisations in that area. And then, you know, collectively organisations take ownership for different actions and plugging into kind of governance and accountability mechanisms as part of that. So it's not just this one department, the council's strategy, and it's their responsibility. It's about really broadening that out so everyone can play their part.
And I think that's really helpful. And I think in Hackney, I think we're really acutely aware, particularly, you know, in this space, of how intersectional and complex a lot of our residents that we're working with needs and issues are, requiring lots of different services, or, as you know, as we heard from Fiona, around those experiencing impacted by hoarding and all the kind of intersectional. I suppose in Hackney, we were also really consciously aware of the lack of trust that many of our residents have in the state and institutions that may have let them down over and over again. And, you know, and particularly specific communities disproportionately affected both by, you know, health inequalities and you know, and financial inequalities, you know, and particularly sort of Black and global majority communities. So I guess for us in Hackney, it's been really important to us to work with the sector and those grassroots groups that are closest to those that have been sort of failed by us in the past. And I guess, you know, that trauma-informed approach, and that both to how we work with the sector, the trauma-informed kind of anti-racist approach with how we work with both the sector and the residents, feels really important if we're really going to reach those residents that need the support but may be least likely to ask for it. And I guess I was curious about, you know, how how the intersectional lens is applied when we're thinking about poverty, because it strikes me that often we think about it in isolation, where it cuts across, as you say, everybody's work. And I think, you know, we've got colleagues in council tax, transport, children's services, lots of voluntary sector organisations working with lots of different groups specifically, but poverty will be impacting on many of those that we're most worried about experiences. So I guess, yeah, is there anything that you can sort of speak to around intersectionality in terms of sort of poverty, at the intersection between sort of poverty and experiences of racism?
Yeah, I mean, we talk about that quite a lot on the Tackling Poverty with Data course, actually, because we look at some like the national poverty data, which, you know, unfortunately does show, you know, we do really badly in this country in terms of, you know, single parent families, much greater risk of poverty, households where there's disabled, at least one disabled person in them, a much greater risk of poverty. Certain people from certain non-white backgrounds at much greater risk of poverty. You know, it's stuff kind of a lot of us probably aware of and know, but often, like you say, in the kind of wider discourse about poverty, gets forgotten or doesn't get enough attention. And I think the pandemic really brought to the fore, didn't it, how that intersection between low income and certain groups of the population is actually really strong, and it was those groups of the population then that bore the worst consequences of the pandemic often. So I think that's kind of brought that to the fore, and it's something we mustn't lose sight of. So we do focus on that quite a lot, and there's a few ways and a few reasons why that really kind of matters. Obviously, a lot of the pressures that public services are under as a result of high levels of poverty. And so thinking about that kind of intersection and your service users or your clients, whatever terminology is relevant to your particular area, is really, really important in terms of that kind of pressure on services, how to respond to people's needs. But it's also, I think, important to kind of, you know, we talk sometimes too much in a silo in terms of like equalities and socioeconomic disadvantage. And I think sometimes it can be easier in some instances to talk about certain equalities issues without bringing that socioeconomic disadvantage aspect into it. Because there are some perhaps light touch or quick wins that we can do to kind of respond to some of the prejudices and disadvantages that certain communities face. But ultimately, if certain communities are disadvantaged to the extent that they are more likely to be poor, we've got to do some really significant work and significant interventions to address that and maximize people's, you know, financial position and understand why certain people from certain backgrounds are more likely to be financially sort of disadvantaged and the deep-rooted aspects of that. So there's several reasons why that's really important and particularly sort of relevant to our focus as an organisation.
Thanks, Graham. Yeah, did anyone else want to come in on that? Pamela? Fantastic, thank you. How are you doing?
Thank you, Graham. That was really helpful. I think I'm from children's social care, and I think our greatest problems is really visibility of services. So obviously our assessment of, you know, families in need and families affected by poverty, I think is pretty good, of being social workers. However, services that we can access to support the families is quite difficult, hence why I always attend these meetings that are really helpful. So really my question to you is, if we did have a family, can we approach your service in terms of actually this family, we know that it's impacted by poverty, but is there a service that could potentially assist them? Because we tend to go with the age-old, you know, it's, banks, food banks, and that's it really. But there is other services that could assist as well. So
yes, yeah. One of the things we do in 7 local authority areas, so not in Hackney, unfortunately, but we'd be really keen to have a conversation with yourselves about it, is Money Advice Referral Tool Programme. And the intention of that is to equip professionals in non-advice roles with a means of making effective referrals into money-related services. And so that's about capturing kind of, Pamela, it's about capturing kind of what's available in an area that is a response to the financial needs of households of different groups of the population, and how does, you know, a GP practice or a pastoral lead in a school or someone working in children's services make an effective referral into the appropriate service that addresses the financial challenges that that individual or that family is facing. Because we know that one of the things we've seen particularly sort of increase over the last 10 years is you've got these very complex local support ecosystems in every locality. You know, every council's council tax support scheme is different. Every sort of local authority VCSE sector sort of network is different. What's available in one place is different to the next place. And actually it's very hard for people working in non-advice roles. You know, if you're in children's services, or you are working in a health setting, or you're a teacher in a school, or a pastoral lead in a school, actually equipping yourself with the knowledge about what is available at any given time in your local area is actually quite challenging. So the money advice referral tool in those areas where that's in place, like I say, 7 local authority areas in the northwest of England at the moment, is an intervention directly in response to that kind of need, Pamela. So, you know, it's something we're absolutely keen to kind of talk to other localities about developing.
I'm grateful. Thank you so much. Is it possible to send that to us to me directly, or is it going to go through Jenny's?
Yeah, I can do. I can go through John. I've got John. It's John I've been liaising with, so I'll go through John, Pamela, and I'll just flag an email for your attention through John, if that's all right.
Great, thank you. Did anyone else have any?
Thank you.
Thanks, Pamela. Did anyone else have any other questions for Graham before we move on to the next presentation, or any reflections they want to share? Okay, thank you so much, Graham. Feel free to stay with us, or to come back another time. We'll do,
yeah. Cheers. I'll stay for another 10 minutes and then I've got to drop off, but great to see you all. Thanks so much.
Thank you. Okay, so welcome, Tobias, from our transport team.
Hello, my name is Tobias Newland. I'm a senior transport planner working in a street scene department, and I'm working on a new 10-year transport strategy for Hackney. And I've got a brief present. We're currently doing a public engagement exercise. We're not writing the strategy at all at the moment. We're just listening to people, and many of the issues, I believe, relate to poverty reduction. So I will just give a very quick presentation, and I will try and shorten it because some of it might not be relevant. Yes, so it's a 10-year new transport strategy running from 26 to 36, and it replaces our current 10-year strategy, which we produced in 2015. So we've been looking backwards at how we did in the targets we set in 2015 and looking forward towards 2036. So basic overview, it's a transport strategy engagement. It runs until the 9th of June, and all of the details of it consists of an online survey and of an evidence base, which is basically a bumper pack of facts and maps and diagrams and key facts about transport in Hackney. So transport is really important, connects us with work, friends, services, and it also impacts our health, the environment, mobility of vulnerable people such as children and the elderly. Yeah, so it's basically the first stage of producing a new strategy is to listen, and the second stage will be to write it. The third stage will be to consult on the draft, which we hope to do later in the year. And I mentioned before that accompanying it is our bumper pack of transport facts, which is we're calling an evidence base. So essentially, that's sort of the short version of my presentation. But I thought I would just go very slightly deeper into this and look at, first of all, the questions within the survey, and secondly, some very, very basic facts about transport in Hackney. So first of all, I'll do a very basic facts about Hackney and transport, and this is one slide from our evidence base. I think I've got the wrong. Yes, that's it. Yeah, this is the basic fact of Hackney. And most people in Hackney travel by public transport or walk or cycle. A full 87% of all trips in Hackney are by these means. Car travel, you see a lot of cars on the road, but actually most households in Hackney do not own a car. 65% of households do not have access to a car. So the really important ways that people travel are by active travel, which is walking and cycling. 62% of all trips are by walking and cycling. And in particular, walking, which is nearly more than half of all the trips that Hackney residents do. We try to protect walking and cycling through controlling traffic, but still there is a lot of traffic on Hackney's roads, particularly the main roads, and 44% of all the traffic on Hackney's roads doesn't actually come from Hackney residents. It's vehicles traveling through Hackney and out the other side, just using the Hackney roads. So it doesn't actually produce any economic benefits for Hackney, and it really just produces problems in terms of air pollution, congestion, collisions, and an intimidating environment, really. So that's very basic facts about background to transport. And I have a lot more which I won't go into, but I will just now also look at the questions that we are asking. And these questions are in 3 parts. Yeah, these questions are in 3 parts, and they consist of the transport basics, which are how do people get access to the places they need to go to, and also the quality of the places they need to go to. How do the way that we design our streets deeply influences the way that people experience the public realm in Hackney. The second set of questions is to do with the social and environmental impacts of transport, whether it's air quality, whether it's health, whether it's road danger or collisions, or carbon emissions. So, and the third set of questions, relates to fairness issues. I briefly alluded to the fact that most households in Hackney don't have access to a car, but they still suffer from a lot of the problems of traffic. So I'm just going to look at these are the transport basic questions, and I just wanted to. Yes, I'm just checking to see that I've got the right thing, so I'm skipping between 2 different presentations here. So I've presented this, and these are some of the facts, and these are the basic questions. So there are about the transport basics, connecting places, ensuring all residents can reach the majority of places in their neighbourhoods for leisure and trading, by reasonable journeys, by walking, wheeling, or public transport. And in terms of poverty reduction, this also affects access to jobs and training, also social opportunities and shopping and everything that people need. Transport is also essential for unlocking opportunities for new regeneration within the borough. And unlocking regeneration opportunities is a really key way in which local economic prosperity within Hackney can be encouraged. So these are 3 questions. I can see 2 of them immediately have an impact on poverty reduction. Second set of questions is about the social and environmental impacts of transport: safer, greener, healthier. And again, there are a number of facts to do, I'll skim through, but basically, these are the questions. It's safe and secure, it's cleaner air, greener streets and places, lower carbon emissions, and health. And particularly, there's an intersection between ill health and poverty. And ill health can easily lead to loss of income and career opportunities. One of the best ways of protecting health is through exercise, and particularly through active travel. So we know that many Hackney residents get little or no exercise from their everyday travel, and that directly links into chronic health conditions, diseases, and indirectly into poverty as well. So the third set of questions are to do with fairness. And these are basically, there's some facts about way disabled people travel, car sharing, net zero aspirations. And the 4 questions under the fairness section of the questionnaire about access to all, and that is particularly looking at the way that mobility affects disabled people. So we are seeking to make our transport system accessible to all, and we know that there's a big overlap between poverty and disability, and you'll see that many people believe that disabled people are more car dependent, but when you actually look at the facts, a lot of disabled people are actually dependent on walking and buses, and because there is intersectionality between disability and poverty. Equitable, that we need to make sure that in seeking to address the sort of climate impacts of transport, we don't overlook the impacts on disadvantaged groups. So we need to adjust transition to a greener economy. And finally, perhaps most obviously, we need to make sure that transport is affordable, that we protect our bus services, which are the lowest cost public transport that we have. And when we commission cycle hire services, we make sure that micro-mobility services are also affordable as well. So that's really the 12 issues that I have in the survey, and I don't know whether to go through more of the evidence base really, but I will just stop there. We are looking at producing this by 2026. We're doing a variety of engagement activities. We're talking to lots of transport stakeholders, TfL, Living Streets, London Cycling Campaign, London Travel Watch, the freight associations, taxi drivers, Sustrans, Campaign for Better Transport. And we're also doing a lot of focus groups and local meetings with neighbourhood forums and panels and schools, a disabled residents focus group, a young person's focus group, religious groups, and also events such as the Zero Emissions Network event, which took place recently in Hoxton, and also Cyclopedia Street Party. And we're also aware of like a lot of toxic narratives around transport, people arguing about different ways of addressing transport problems. And to deal with these, we're looking at also a more deliberative approach to solving issues. And we're working with King's College and the London School of Economics to introduce something which is a bit more deliberative around something like citizens' juries or mediation or small groups talking to each other. And as well as this, we're doing some scenario planning. So we're doing a wide range of engagement activities. And basically, it's all on the Hackney website. There's a QR code, and the survey closes on the 9th of June. So that's basically everything I wanted to say. So happy to take any questions. I've left out so much because I didn't want to blind you with lots of facts, because it can get a bit too much, but happy to produce any facts that I have.
Thank you. And we'll be sharing the presentation, I think, won't we, Tobias, in the newsletter. So if people do want to dig into it and find out more. I guess, one question I had was just about the engagement activities you're doing, if there is anyone on the call who has groups that they're working with that may not fill out a survey and might want to have a say, are there still opportunities to add to those lists for those on the call, or is that as much as you're able to manage in terms of, I mean, it's obviously you're doing a lot of engagement already. I'm just conscious that there are lots of people on the call here who work with service, who are working with residents, and who are working with specific communities that have trusted relationships where they might be able to garner insight that way if people had particularly strong views, for example. Or
yes, we're happy to sort of engage with whoever wants to engage with, really. Whether it's through a sort of forwarding, flyers or posters, or even organising, I don't know how many of these we can, even organising short face-to-face meetings.
Yeah, great. Thank you. That's really useful. And yeah, absolutely. I mean, we've heard quite a lot from older residents and people working with older residents about impacts on of lots of these things in terms of affordability and how it feels traveling around Hackney. There's lots of intersections here in terms of affordability and how people can get to appointments, and we heard lots of I guess insight through the initial stages of the cost of living crisis about people not attending health appointments because they couldn't afford the bus fare and things like that. So this is a really important area for us all to kind of feed into, I guess, from that point of view, because we do have that insight into those who have lived experience, who might well be struggling in that sense as well.
And also there's a basic fact that Hackney doesn't have any deep level tube lines. We are very dependent on our surface transport of one sort or another, although we do have the overground, but we don't have anything deep underground. So there's always been some kind of missing gaps within the Hackney transport, which has made us quite unusual.
Yeah, that's interesting. Well, a chance to look at that, I guess. Does anyone have any questions for Tobias or anything they want to raise in relation to the transport strategy or transport in Hackney for residents? Or
Only to wish him luck, because it's quite a divisive subject, shall we say.
Yes, it can be.
Certainly can. Thanks, Neil. Great. Thanks so much, Tobias, for joining us. And I think we'll go ahead. I think Neil hasn't got any slides for us, but is joining us to give us the latest on some evolving work in the council tax service. And wanting to share some updates with you, I think.
No slides. One, because I'm rubbish at doing slides, and two, they didn't work very well. So it's more of just a conversational bit to let you know that we'll split into two parts. At the minute, we're working with the voluntary sector to create an enhanced understanding of council tax, of the reliefs, of the council tax benefit side of things. Because as with all things, certainly from my side, there was an assumption as to what the knowledge was out there, and the knowledge was good. But I'm learning quickly that because the third sector is dealing with so many different councils, potentially everyone with a different scheme, everyone with a different way of working. So I have very much not been involved with this, so it's not my good news story, but those that have been involved, we're probably moving to a point now where we're going to be piloting with some trusted partners a more direct route into our services for those trusted partners, which will hopefully mean that the residents who are less keen to engage with us, and for the reasons Jenny said earlier, for a lot of them, or the assumption that they think we are some all-knowing oracle, I can assure you we're very much not an all-knowing oracle. We're going to see how that goes, and obviously if that works well and it means that those third sector are able to better serve our residents, then we'll be looking to roll that a bit more. So coming back to this meeting and seeing who else would like to be involved. And one thing we're very conscious of is there's a reason some residents will go to the third sector, and that's because they're not the council. So we're very much keeping it at a distance. The third sector will not become the council. They're not de facto the council employees. They're working to assist the resident, but are also aware of our requirements, our end of the council. So in a nutshell, how this should work and how should in reality might be different things, and we'll have to work on those. We should be at a point where resident X goes and sees provider Y, provider Y comes in through the appropriate channel and we will deal with that case as if that person represented the council. So if they're telling us XYZ can only pay Y, we'll accept that. So we're just trying to cut some of the layers out. So hopefully that will be a good thing, and it will enable those residents who aren't engaging with us to come in via a friendly third party, and then we can deal with the case.
Brilliant.
So
Yeah.
that's where I'm with that. I'll do the other bit, and then I'm open to questions, but just be gentle because I'm not directly involved with it. It's my team are, so I won't necessarily have all the answers. So
Yeah, just pause on that one before you tell us the next bit, because I just want to make sure people have understood, because there's a lot of information quite quickly, and for those who don't have the context, I think it's really helpful framing, I guess, Neil, to sort of link it back to the conversation earlier about residents that don't trust the council or won't come to the council, but also your reflection that there might be a fantasy out there that all of our data is joined up. There might be a fantasy out there that we know, that Neil knows, that Pamela's service, for example, in children's, is working with somebody who is in a situation where they really can't pay their council tax because of lots of complex reasons that if Neil's service knew about, they might take a different approach. So I guess this opportunity of having of Neil's service trusting that people who refer through this, who can contact sort of through this pilot initially, this sort of prototype, I guess, initially, gives us a chance to sort of really build that better picture of a resident's full experience. And I suppose Neil's point about the sector will always be independent, so if you're in the voluntary sector and you're working with a resident, what they love about that is that you are independent of the system. So it's really important that you maintain your independence, but it's also really important that you know how to get the best help from the council with their council tax and all the other things that might be weighing on their mind and making things difficult. So I guess we're really excited about this work with Neil's service and the voluntary sector partners who are involved in it. I think we've got I think we've got 3 or 4, isn't it, voluntary sector organisations on board with it, and Jonathan on the line has been really integral in the process of this work as well. And there's a whole lot of stuff going on, including a money clinic, isn't there, which I think, are you going to talk about as well, Neil and Jonathan, or is that not coming up today?
I wasn't planning on, because it's not really ours, it's someone else's. I was really going to talk about that piece and just promote the portal that we've got up and running.
Right. Oh, before you do that, in relation to the escalation route, I just think it's important we keep it in this conversation, in this group. If anyone is really interested in learning more and being on a list of people that we get in touch with when this is live, please put your email addresses and your service name in the chat so we can follow up with you, because I think we'll just keep it on the agenda, won't we, Neil? And then as people express an interest, if you're working with people who you think might have debt to the council and might need support with that. So if you do feel like that might be useful to you, this being a part of this small pilot that will be through this work, please put your email in the chat and we'll definitely follow up with you, and we can explore we'll explore that further with the team working on it. But we're really delighted that we're taking a chance and having a go at doing this. And I think it could really make a difference to residents' lives. And help with the council in terms of making sure that there's a sort of payment plan moving forward and preventing eviction and all sorts of things. So really important work to us. Did anybody have any questions or comments on that before Neil talks about the next bit? Because I know there was quite a lot of information coming on the back of quite a few presentations. So no questions now, but feel free to get in touch with us about it. John Davis, who holds this session, is leading on that, so do get in touch if it's something that you think you'd be interested in. Okay, and now the portal. So this is a separate thing. Another
was just to say, we launched back in September a soft launch of a council tax portal, which briefly existed back in 2020 and then went offline for a few years. It's back up and running now. So we're conscious that getting through on the phone line, getting a response to emails or forms, we deliver a good service, but there's always delays for one reason or another on specific cases. So for those of you who are supporting residents, it was just to make you aware that if you go to the council's homepage, on that page is a link to where residents can sign up for the portal. It's painless. He says, I haven't done it myself. I don't live in Hackney, but I've done it where I live, and it's the same setup. What that will enable residents to do is to look at their council tax account. Those in receipt of benefits can also look at their housing benefit account. And what it will give them, it will give a resident the opportunity to see the council tax, what the bill is for the year, what their instalments are, what they've paid, what's due to be paid, what they haven't paid. And we're not changing the structure of how we handle phone calls or how we deal with correspondence, but it's just another avenue that might help a resident get a handle on their account without the need to wait 15, 20 minutes, 30 minutes in a queue. So we're kind of encouraging those who are able to, and we appreciate not everyone can go online, to go online, and we're going to be enhancing the service with a few adaptations during this year to enable residents to do more and to communicate certain things just through the portal. But what really I'm flagging it is, we generally send text messages and emails to residents when they are falling behind with their payments. And within that, there will be a promotion of the portal, because it could help that resident resolve in a couple of minutes a question that might take them 20 minutes of sitting on the phone waiting to get through. So we're trying to take away, we're trying to add a channel in rather than take a channel away, because I'm conscious that initial views might be, oh, does that mean they're getting rid of the phone line? It doesn't. It just means we're trying to add another layer in. So
you can free up the phone line for people who do need that more one-to-one.
Potentially, and that will still be there, the phone line. The HSE will still be there, to the best of my knowledge, because obviously nothing lasts forever. So I'm not going to commit us to it for the next 10 years, but it's probably just bringing us back onto a par with 99% of the councils in the country, having an online portal where Joe Blogs, Mrs. Blogs can go in and do some self-serving if that's what they want to do, but the other services will still be there. So it's just to say, it's on our front, it's on the council's front page, it's obviously on our council tax page. It's easy. You need your account number and an email address, and then sign up is pretty easy from that.
And we'll include that in the newsletter, won't we? We'll include the clearest instructions on what that looks like, if we can, within the newsletter, because I think it's often these meetings is such a lot to take in. So if we can include in the newsletter just something that helps people who are working with residents who might have received a letter or might be able to get online, then it'll be helpful for us to sort of see what that looks like and make sure that we know what the web link is, because, you know, we've always got so many other things floating in our heads, haven't we?
If we can share that with John and put in it, I'm just a bit conscious that how someone will generate their login is going to be dependent on what we know about their account. So without going through it all, to log in, you basically just need your account number and information on your account. And depending on what information you have, you answer questions. If you score enough points, you get instant access. If you don't have enough knowledge, it asks you, it will send a PIN number to you. So we can't give this is how everyone will log in, but we can give some basics as to, if you know your bank account and you're paying by direct debit, you'll be able to get in straight away. If all you've got is your bill and you've got no unique identifier, then it's going to be more difficult. But Jonathan put the link in the
thanks, Jonathan.
We'll add it in, but we'll give a descriptive, Jen, but because the journey might be different.
Got it. Yeah.
We'll do it for the majority, shall we say? But and obviously, if anyone's struggling, they can ring us, and the call centre can help people get through and can effectively push them onto the portal if that's what they want, if they want to help getting on. Yeah,
great. All right, brilliant. So we've got, thanks so much, Neil. Oh, sorry about that. What's that?
No, that's what I'm just saying. Thanks. It was just a little promotion that if people want to use it, be one of the 14,000 who've already signed up.
Let's see how we go. Yeah, brilliant. Thanks, Neil, and great work. And I wondered whether, Joanne is still on the call. I know there's been a lot of presentations, and lots going on. But Joanne from Queertopia.
Yeah, of course I'm here. Come on. It's good to find out about other services and what they have on offer. I'm not always able to be here, so sometimes mail comes in my absence. So yeah, I'm really grateful to be here and be in this space. I wanted to share with everybody. So we have, we call it business and partners, but if for services like yourselves, to come along to our forum, which is on the 19th of May at 2 p.m. till 4 p.m. at Shoreditch Town Hall. So each month we have a different chance to like network, talk to other agencies, other queer agencies as well, and to figure out like how we can support the community better. So this month,
sorry to cut you, Joanne. I just want to in case people didn't see your presentation and hear about your organisation before, I just wondered if you could just briefly sort of say what your organisation and so this is the forum, but you obviously represent a lot of work that Queertopia do, and just reminding those on the call of what you provide as a sort of broader.
Okay.
And promote the things.
We'll start again. My name is Joanne English, and I am from Queertopia Consortium. We support the queer community here in Hackney, so we bridge access and building belonging for the community. We have monthly forums where we invite services to come along, connect, build relationships, and find out how we can support the queer community better. All right. So it's a space where we'll discuss different themes. So this month, we're going to be talking about the Supreme Court ruling and how we can be supporting trans community here in Hackney, whether there are employees, beneficiaries that's accessing your services, and just to make services more equitable, right? So we do that once a month, and you can register on our website where you can get updates about up and coming events if you're not able to make it for this one. And we also have a community space as well. Our forum's on in the next 45 minutes at 6 o'clock at Dalston Library. So that's why I've probably like going really, really fast. And so we're having a space today. Once a month, we meet to talk from the community. And also like if people's got events that's happening and they want the community to know, they can come along and sort of like pass that information on to me. And I can share it with the community.
Amazing. Well, there's the fact I wanted Pamela to hear about because we've got Pamela from Children's Service, and I wanted Pamela to hear about the picnic.
Queer picnic.
Yeah, because I was
Queertopia Summer Special. So we got Queertopia Summer Special happening on the 1st of June. I hope that we've actually got good weather like today. Okay. So it's a space where families can come along, queer families can come along, adults can come along, everyone's welcome, allies too. We're going to be playing some rounders, you know, bringing back some old school games, egg and spoon races. We've got loads of sort of like games in the bag, but also you can just come and just chill. It's just a vibe, right? A little bit of music, bring a dish, share with somebody, because there's nothing like breaking bread with like neighbors. So it's a space to like connect and build relationships really. So we have that happening in the library. So Pamela, tell your beneficiaries, even if some of your colleagues wants to come, they're more than welcome to come along as well. And it's a really nice space.
Thank you.
I'll send over some flyers to Jenny so they can forward it on to everyone else.
And we'll put them in the newsletter, and I know loads of the people that come to this space forward on bits and pieces to others as well, so really really useful. And we've got a great, so Daniel, is that a message? That's a message to Joanne, right, to come along and promote the Solihull offer. Excellent. So I think have you got Joanne's email in the chat? Or if not, we can put you in touch with Daniel separately. Joanne, if you're still on the line. I know you've got to rush off because you've got your session. Thanks so much for jumping in. Does anyone have any questions for Joanne about all the work of Queertopia or the particular events or forums? Anything anyone wants to come in on? Oh, amazing. Thanks, Joanne. Any questions?
Yeah, I am here. I'm just rushing to get ready at the same time. But if anyone's got any questions, please feel free to email me, call me as well. Yeah, and I'll do my endeavors to get back to you.
Brilliant. Oh, I hope it goes well tonight. And I'm going to try and
Thank
come on
you.
the 19th. It sounds, yeah, that one sounds.
Oh, we look forward to seeing you, Jenny.
Yeah, and maybe the picnic too. But yeah, thank you so much. Great, thanks, Joanne. So we have 10 minutes left, and what we usually do is open up the floor in case anyone has any questions for others on the call, anything they want to share about that they might be doing for residents that they want to promote, any sort of short, sharp presentation on anything that, yeah, they think that the group might want to know about, or to share any insight in relation to your work and what you'd like to see at the meeting. So if anyone wants to come in, please do. Great. Daniel, how are you doing? Good to see you.
Hi, everyone. Sorry, my connection's not very good, so that's why I'm not putting the camera on. And I'm outside, standing next to my car, which is kind of weird.
Good. I'm glad you're in the warm on this beautiful day.
It is a lovely day, yeah. Hi, everyone. I just wanted to put the feeler out there that the Bernardo's team are signing up staff still from the voluntary sector for the foundation workshops that we're delivering on. If anyone has already completed the Solihull approach, we've also got a refresher course. So I'm sure Jenny can share the link, or everyone knows where to contact us. But if you could share the link. So if there are people that have completed the foundation course already in the last, I'd say 5, 6, 7 years, and you just want a refresher, it's a 1-day refresher course. They're online. We've had a lot fewer people sign up to it than we thought they were going to do. So please feel free to do it. If you haven't completed the foundation course previously and you're interested, it's especially open to the voluntary sector in the next quarter at least. So we'd really like as many people to sign up to that. And then on a separate measure for parents, we're also delivering on a youth Solihull program. So if you've got people that are aged up to 19 and then up to the 20th birthday and up to 25 with SEND needs, that includes emotional well-being needs, please get them to sign up on self-register on any of the courses that we've got. They're currently happening out of, I'm going to say, the Daubeny Family Hub and local to Clapton, and we're going to have one at the Ann Taylor Centre as well. All the other courses are still online, so please, just a reminder that we're still here and we're still delivering. Brilliant.
Yeah, I think we included in the last newsletter some details so you can look back on that, but we'll also include a reminder in the next one if you just send those details through to us, Daniel. And so, yeah, people can look back and see what's what. That's brilliant, and good luck with it. Yeah, anyone else got anything they want to share, ask? We'll give you the 7 minutes back in that case. And just thank you all so much for being here and for all the presentations today. Lots of really rich information shared as usual, and really appreciate all your amazing work out there. It's not easy, and I hope you take care of yourselves. See you soon.
Thank you, Jenny.
Bye, everyone. Have a wonderful evening. Take care.
Thank you. Yeah, thanks so much. Take care, everyone. See you soon. Thank you.